Yes, we are extending the indication for reverse, and this because the outcomes are more constant than in the past. But this has a risk on the opposite side that we will have to deal with complications that are not so easy to go over by the surgeries. Okay, so indications for this intact cuff and reverse. We have a variable pattern of indications post-traumatic. In trauma, the hemiarthroplasty or the total anatomical arthroplasty, they don't always have a good outcome. Inflammatory arthritis. In the inflammatory arthritis, this is an option. For defects of version, so in retroverted or dysplastic glenoid for biconcave glenoid, and the humeral instability as fixed locked humerus luxation or humeral subluxation. Another point is age. So in trauma, we can scroll over that. Trauma may destroy the anatomy and may be very difficult to replace by an anatomical implant that a humerus that is so destroyed. This distraction is destroyed. It does not mean that the rotator cuff is gone, but you have to take the rotator cuff and have this back to the implant. And this is not that easy doing. You have to manage with a height of and length of the humerus. And this also is not that easy. You have to go to the opposite side. You have to compare. This is a very difficult scenario. And the more affordable results are with reverse. Even the reverse has to maintain the tuberosities or the cuff or some around the lateral part of the implant to fix the cuff all around. Otherwise, you will have some dislocations and complications, even with the reverse. So take in mind, the reverse is not for who has no tuberosities. Reverse has that, but is an option, and the outcome is better than for anatomical. Inflammatory arthritis depends on the age of the patient. So if the patient is an aged patient or not that young elderly patient, they have not functional requests that can stress so much the reverse. And the reverse implant does not last with the same functional performance many years. So after 8 years approximately, there's a downhill. So arthritic and bone loss. So age is the age a limit to the total? Depends, because probably this is a patient that is a competitor and he is over 85. So proximal humerus malunion. We can have a good result or sufficient result when the malunion is at the neck. But we have, and this is an opportunity for young people or relatively young people to go for a fixation by the anatomical implant. The cuff, the rotator cuff is intact. But if the rotator cuff is intact and the tuberosity is lost, as in this case, relatively young people, you cannot imagine that this would have a good result with an anatomical. And if you want a good result, you will have to go to a reverse and you have to keep back the posterior, this small fragment, if possible, because this changes a lot the outcome. Locked dislocations. It can happen at any age, and you can develop arthritic changes, or you can, and this is a situation when if you have this in a not a 70 and old, but in a relatively young people, you can go straight forward to a reverse. A reverse have intrinsic stability, and the total anatomic has not that. So by concave glenoid, we know that there's a relatively high rate of failures of grafting with the total anatomical implants because of eccentric loads, because there is not a load onto the graft resorption is often on the way, and there's a loose tension of the tendons in the side and the back side where the tension is lost because of bone resorption or consumption. And this is a B2 and C glenoid. So B2 glenoid. In these situations, the reverse performs definitely better. Any implant, anatomical implant you can use, the reverse performs better. So intact cuff, but reverse. And glenoid dysplasia that can lead to these situations. So glenoid dysplasia needs a graft. You cannot implant any base plate or any not an anatomical. You will lose the anatomical implant, and not just a standard reverse shoulder, because a reverse shoulder, if you feel and if you want to purchase good bone, you would put that in a wrong position. So you have to make again the line, the center of rotation lateral. Otherwise, there's no possibility of good performance of the reverse, and you have to graft it. And the reverse has a metal base plate and has forces that if you tilt downward to upward, your base plate will load the graft, and this is the way for the graft healing. This is another inflammatory arthritis, and in these you have to lateralize the center of rotation. Otherwise, you have lost tension of the rotator cuff, and you have no power to make daily activities. Post-instability surgery. So intact cuff and post-instability surgery is not the option for a very young, but we know that if the development of arthritic changes comes by 10th years, so this can be an option, and we have to care when we go to surgery to make very aggressive surgeries, because in 30 years probably we have to deal with that patient with several problems coracoid grafting and screws and so on. So be conservative. Thank you.